The structural classification divides joint into fibrous, cartilaginous, and synovial joints depending on the material composing the joint and presence or absence of a cavity in a joint. Fibrous joint in sutures between skull bones, cartilaginous joint in intervertebral disc, and synovial joint in knee can be identified. The six types of synovial joints. They are pivot, hinge, condyloid, saddle plane, and ball and socket joints. Examples are pivot joint between C1 and C2 vertebrae, hinge joint in elbow joint, condyloid joint between radius and carpal bones of wrist, saddle joint between trapezium, carpal bones and first metacarpal bone, plane joint between tarsal bones, ball and socket joints in hip joint and shoulder joint. Synovial joint is ball and socket joint between scapula, genoid fossa, and head of the humerus. The articulation surfaces are covered with hyaline cartilage. Main components are glenoid labrum, joint capsule, synovial membrane, synovial bursa, and ligaments. Factors that contribute to stability are rotator cuff muscles, glenoid labrum, ligaments, bicep tendon. Stabilized factors of knee joints are iliotibial band, the lateral collateral ligament, the popliteal tendon, bicep tendon, posterior lateral capsule, lateral head of gastrocnemius. Range of motion is the measurement of movement around a specific joint or body parts. In order for a joint to have full range of motion, it must have good flexibility. Each joint has its own level flexibility expressed in degrees. Passive range of motion is typically practiced on a joint that is inactive. The physiotherapist may use this exercise on a client who is paralyzed or unable to mobilize a specific joint. This type of exercise can be help prevent stiffness from occurring. During this exercise, the patient does not perform any movement, while therapists stretch the patient's soft tissues. Active-assistive range of motion exercises are more progressive, intended for the client to perform movement around the joint with some manual assistance from physical therapist or from a strap or band. These exercises can often painful and the muscles can feel weak. Increasing range of motion with these exercises can be a gradual advancement. Active range of motion exercises are highly independent performed slowly by the client. Physiotherapist's role may be simply to provide verbal cues. To measure range of motion, physical therapists most commonly use a goniometer, which is an instrument that measures angle at a joint.